Welcome to ASRM Today, a podcast that takes a deeper dive into the current topics in reproductive medicine.
I'm Jeffrey Hayes. Today on the show, we're discussing fibroids in the Latina Latinx community. Joining me is Dr. Ruben Alvero, who is professor of obstetrics and gynecology at Stanford Medical School and is the division director of reproductive endocrinology and infertility at the Lucille Packard Children's Hospital. He is board certified in obstetrics and gynecology and in reproductive endocrinology and infertility. He's a fellow of the American College of Obstetrics and Gynecology and the American College of Surgeons. Dr. Alvero, welcome to the show.
Thank you, Jeff. And can I call you Jeff?
Of course.
Or Jeffrey? Okay, good.
Yeah.
I'm great. I'm grateful to be here. Thank you very much for the invitation.
Part of your research interest is improving the health of the Latinx community, as well as evaluating the role of critical thinking in medical education. Now, when I put those two things together, I start wondering, and my question for you then is there a large discrepancy in reproductive care research in diverse communities?
Oh, absolutely. I think that this is one, there are some data that can be inferred. There's lots of, retrospective data that we have looked at. There's a focus in certain aspects of the African-American community in this particular question in particular, just because it is a well-known fact that African-American women definitely have a really much higher rate of fibroids than other populations. What's suffered a little bit along the way is that the Latina, Latinx women population has not had the same level of scrutiny in terms of fibroids, in terms of their utilization of treatments for it. And so those are aspects that really need to be addressed. And luckily, there's some things we'll talk about that actually are taking place that are improving the processing of this information.
Is it due to misinformation or even lack of information that's causing the issue within the Latinx community?
It's a constellation of issues. And part of it is that much of the data is retrospective and actually self-report, which makes it harder to interpret because it may underreport the number of women that truly have fibroids. Because there are many women that may have fibroids and don't know it because they don't have symptoms, or they haven't, what Erica Marsh, who's another leader in this field, who's done great work in this area, refers to as an altered perception of reality, or I forget the exact term she used, but it was an altered perception of their symptoms, which may lead them to think that, this is something that is not abnormal. And then they therefore don't seek care. Earlier, there may be a delay in diagnosis, which obviously, anytime that happens, there's worse things happen because more aggressive treatments may be necessary down the line when they could have been less invasive if they were caught earlier.
And Fertility and Sterility, in the issue, I believe, of the fall issue last year of 2020, issued a number of articles about this. What were some of the major findings? Was there surprises? I know that there was still the call to do more research, right. But was there anything that you saw that was surprising? Not really, because honestly, I've been in this field long enough that I'm not surprised when there's not as much information as there should be. Now, there's never enough information. There's never enough research that has been done. There's always more you can do, and each research article leads to further questions. But really what is necessary going forward is to prospectively address and collect more information so that we can, inform both providers and patients. That's one of the problems is that providers are often not misinformed, but their perception of what needs to be done is not as heightened. There is a really well-recognized discrepancy in the use of abdominal hysterectomy, for instance, compared to laparoscopic hysterectomy among Latina women and also African-American women. But since we're addressing the Latina women, among Latina women, they are more likely in general to get an abdominal hysterectomy, which is a potentially more morbid procedure. And this is even when you control for risk factors such as fibroids and so forth, which, if they're very large, may lead to the necessity to do something like an abdominal hysterectomy. So
So I think that there needs to be more information available. I think that there needs to be more aggressive action, but there's also needs to be a community education, because many women don't recognize that their symptoms are truly abnormal. And that's something that's important to address. Now, how we do that really is, it's all location, depends on where you are. If you have geographically an area where there's a larger church-going community, and maybe through there, but it depends on how the tool that you use to educate women. But it is important to do because it may empower them to seek the treatment that they deserve, and they may not be aware of laparoscopic versus abdominal. That's an important distinction that may not be something that's commonly known in many communities, all communities, regardless of racial or ethnic background, but particularly in a community where, they may be new to the country, they may be using public insurance and things like that. All of these factors can affect the kind of empowerment people have or women have to seek the care that they deserve.
It's interesting. You keep mentioning communities, getting out to the communities, being in churches, in places that that communities will hear people out. I guess that leads me to ask you is, should physicians and specialists start going out more often? Should they be more involved in the community? For example, I know that it's for a lot of professors, it's part of their degree track, or it's part of their job to keep going out and building in the community and being in that outreach. Do you feel that same way should?
Yeah. I've always been a big proponent of advocacy from physicians. I think, even outside of this topic, and in terms of, climate change, in terms of so many other things, I think we have been too darn silent in terms of our advocacy. And I think that that's something that we really need to do, is to get out into the communities and use our knowledge, because we have a certain level of respect among community members, in some cases suspicion, and there's no question about that, and that's another thing we need to ameliorate. But I think that there's a significant respect that we do hold in the community that we are just not utilizing appropriately. There's a narrative that we can use to educate and try to push for better understanding of medical and biological issues. But we're not really good at narrative. We're not really good storytellers. And so when we don't do these things, then, the community, doesn't get the full value of the education we have, the skill set, the clinical acumen that we've had over the years that, they don't benefit fully. I mean, if they see us, it's a 20-minute visit in clinic, and then, then they forget some of the things that we said and so forth. But if we're out there in the community and it's something that is a consistent part of our, advocacy, then I think it's something that's going to be, more sustainable. And I think that folks would be better educated in the long term.
I'm speaking today with Dr. Ruben Alvero. We're talking about fibroids in the Latina and Latinx community. You mentioned earlier that, there are some positive things happening and also on the horizon. Could you just take a moment to talk about those?
Well, I mean, one of the things I've been in communication with, again, Erica Marsh comes up a lot, and Erica Marsh is a real powerhouse in fibroids among African American, and she's turning her direction very much in the direction of the Latina population at this point. She's currently conducting, and I'll read it just because I want to make sure I get it right. It's the Environment, Leiomyomas, Latinas, and Adiposity Study, otherwise known as AS, ELLAS, which is prospectively looking at fibroids in the Latina population. And one of the real problems with prior studies have been, like I said before, they're self-report, and self-report is not always the best way of getting the information. It's sometimes inaccurate. And, sometimes you forget that somebody told you, if they told you 5 years ago that you had a fibroid, you may not remember that if you haven't been having any problems, or if you don't perceive that you have any problems, then that you may not know that, so you may underreport. By doing this prospectively and over time, we actually are going to, she and her team will be looking at the growth prospectively, and then also using ultrasound, not taking somebody's word for it, but actually going ahead and doing an ultrasound to really assess what the impact of fibroid burden is on these women.
Normally, and I am more of a lay person in this, but from my understanding too about it, and my wife, had suffered from fibroids, it's usually an early indicator is heavy menstrual bleeding. Is there anything that you would recommend to your fellow physicians who will begin treating more of the Latinx community, what would you suggest to them as far as like what they should be looking for diagnosis wise?
Yeah, no. So in terms of evaluating patients that come to us, I mean, I think that we need to utilize all the tools, and ultrasound is a very powerful one that we have to assess women that may have come to you complaining. And I think that this is not something that's a mystery. I think the majority, I can't think of anybody that wouldn't, of patients that come to you and they say, I'm having heavy menstrual cycles. Well, an ultrasound and a physical exam and a CBC, and there's certain basic things that we do to assess that. So I don't think that that's really a significant mystery. I think that the complexity comes in, and part of it is how the patients perceive their diagnosis. Because they may see, it's an interesting thing. There are some studies out there that have looked at that and how they see their symptoms. And they may say, well, my mother had very heavy menstrual cycles, so this is the norm for, this is what I expect. And I kind of expected this to happen. Separately, I do some research in Wyoming among a Native American population, looking at PCOS there. And unfortunately, COVID has put a real stop to that recently. But, one of the things that we were working on is basically qualitative assessments of how women perceived their symptoms. And one of the things that we found is that women thought that they were supposed to not have periods and not be able to get pregnant. And, they really didn't realize that PCOS was a thing. And so this, the same kind of thing happens with fibroids, with abnormal uterine bleeding, with symptoms of pressure on the bladder, pressure on the rectum, that these are not normal findings, and there are things that we can do about them. Now, it's easier to do things earlier in the course when the fibroid's smaller, perhaps. Maybe it's accessible hysteroscopically, and then that's easier to take care of. Once it gets beyond that, then it's something that is a little harder to take care of. So I think that just addressing these things, I don't know that most providers would not do these things, but there's no doubt that there are disparities in how physicians, see their patients, in infertility in general. I will tell you that we did a qualitative study back in Denver a few years back. And one of the findings was that a lot of physicians didn't think that there was fertility or that there were fertility issues in the Latina population. The perception was, and this is very, it's I don't understand how you come to this conclusion, but that Latinos and Latinas don't have problems with fertility. Well, no, of course, every population has a rather constant rate of infertility, and that includes everybody, including Latinos. And so I think that there's that change in perception. Now, one of the other things that is a disparity is where you are. So if you're working in a situation and, it's hard because you're serving primarily a public insurance population, there's issues that may, from your perception, complicate things in terms of access to care and so forth. But we got to treat everybody, absolutely the same, and there's a standard of care. And so whether you're in a urban or rural or teaching or non-teaching, I mean, we really need to kind of hold to a very high standard of how we care for our patients. And that's that regardless of background, ethnicity, race, socioeconomic background, whatever. And I think that there might be, I think it's pretty well recognized that there might be a disparity in these areas.
Well, I appreciate your time today, and I am just in awe of the work that you're doing right now. Dr. Ruben Alvero has been my guest today. Thank you so much for being able to come on the show.
Well, I appreciate you having me, and I look forward to working together in the future, perhaps on other issues as well. Thank you very much.
Absolutely. I'm Jeffrey Hayes, and this is ASRM Today.
This concludes this episode of ASRM Today. For show notes, author information, and discussions, go to asrmtoday.org. This material is copyrighted by the American Society for Reproductive Medicine and may not be reproduced or used without express consent from ASRM. ASRM Today series podcasts are supported in part by the ASRM Corporate Member Council.
The information and opinions expressed in this podcast do not necessarily reflect those of ASRM and its affiliates. These are provided as a source of general information and are not a substitute for consultation with a physician.